Imagine you're 5 years old. You're playing in the kitchen and you accidentally lean your hand against a glowing red stovetop. Most kids would scream. Most kids would pull away in a heartbeat. But not you. You just stand there. You smell something burning, but you don't feel a thing. To you, pain is a myth, a fairy tale told by other people. You are one of the invincibles. But as you're about to find out, never feeling pain isn't a superpower. It's a biological death sentence. While it sounds like a dream to never feel a headache, a toothache, or a stubbed toe, pain is actually your body's most important survival mechanism. It's the check engine light for your soul. Without it, the world becomes a minefield where you have no map and no warning signs. Today, we're exploring the terrifying, fragile reality of congenital insensitivity to pain, or CIP. We're going to look at why humans have this annoying feature, and what happens when that system completely breaks down. So why do most of us feel pain while a rare few don't? It all comes down to tiny sensors in your skin, muscles, and organs called nociceptors. Think of these as your body's dedicated alarm system. They don't just feel touch, they are specifically tuned to detect damage. When you step on a Lego or prick your finger, these sensors fire off an electrical signal that travels up your spinal cord and screams danger to your brain. In people with CIP, this alarm system is permanently muted. It's almost always a genetic glitch, specifically a mutation in the SCN9A gene. This gene is responsible for building the sodium channels that nerve cells use to send those electrical pain signals. If the channel is broken, the signal never leaves the station. The injury happens, the tissue is damaged, but the brain remains in total, blissful ignorance. There's even a more severe version called CIPA, where patients not only lack pain, but also cannot sweat. Without the ability to sweat, these individuals can die from simple overheating because their brain doesn't realize their core temperature is hitting 40 degrees Celsius. For a normal toddler, the world is a series of ouch moments that teach them how to survive. They touch a thorn, it hurts, and they never touch it again. But for a child with CIP, there is no teacher. For parents, it is a 24-hour-day horror movie. Infants with this condition often accidentally mutilate themselves during the teething phase. They might bite through their own tongues or chew their fingertips down to the bone, because they simply don't realize they are destroying their own bodies. As they grow, the injuries become more structural. They can break a leg on the playground and keep running on it for hours, turning a simple hairline fracture into a shattered bone or permanent joint deformity. They don't get the negative feedback that tells them not to jump off high walls or play with fire. This is why many children with CIP require constant supervision and even protective gear, like goggles to stop them from scratching their own corneas, or helmets to prevent unnoticed head trauma. The most terrifying part of this condition isn't what happens on the outside, it's what happens on the inside. Pain is often the only way our body tells us an organ is failing. Take your appendix, for example. For most people, appendicitis starts as an unbearable, localized ache that sends them straight to the emergency room. For someone with CIP, they feel absolutely nothing. They might go about their day, eating dinner and watching TV, while their appendix is literally bursting inside them. By the time they notice something is wrong, usually because they collapse from a high fever, sepsis has already set in, and it may be too late. The same applies to heart attacks, which often signal their arrival through chest and arm pain, or a simple urinary tract infection that, left unfelt, travels up to the kidneys and causes permanent damage. People with CIP have to live in a state of constant clinical paranoia. They must perform body checks every single night, scanning their skin for bruises, checking their joints for swelling, and taking their temperature multiple times a day, just to make sure they aren't dying from an infection they can't feel. Beyond the physical danger, there is a deep psychological toll. Scientists have long wondered, if you have never felt physical pain, can you truly feel empathy for the pain of others? Empathy is largely built on mirroring. When you see someone hit their thumb with a hammer, your brain actually fires some of the same neurons as if it happened to you. But for someone with CIP, that mirror is broken. They can understand the concept of pain logically, but they can't feel the weight of it. This can lead to social isolation or a lack of caution that makes them seem cold or reckless. Imagine trying to explain the color red to someone who was born blind. That's what it's like trying to explain agony. To someone with CIP, they are missing a fundamental human language that the rest of us use to connect, protect each other, and understand our own limitations. So why did evolution keep pain around? If it's so miserable, why didn't we just evolve to be invincible millions of years ago? Because pain is the ultimate survival tool. If our ancestors hadn't felt the sting of a predator's teeth or the burn of a fire, they wouldn't have lived long enough to have children. Pain is the reason humanity survived the Stone Age. It's the body's most loyal, albeit annoying, bodyguard. It forces you to rest when you're hurt. It forces you to seek help when you're sick. It is the boundary that keeps you whole. So the next time you stub your toe or feel the ache of a flu or the sting of a paper cut, don't curse the sensation. That flash of misery is just your body's way of saying, I'm still looking out for you. Pain isn't your enemy, it's the only reason you're still in the game. If you found this deep dive into the human body fascinating, please hit the like button and subscribe to the channel. It really helps us out, and it ensures you never miss our next visual breakdown. Thanks for watching.